The determinants of health are listed here on the screen. There's 12 of them, but the main ones that factor within sexual health in older adults are physical environments, social support and coping skills, healthy behaviors, biological and genetic endowment, gender, and culture. Sexual health provides an opportunity to express not only passion and affection within individuals, but also esteem and loyalty. Sexual health in adults provides social influences that can help within these determinants, as well as gives them um, evidence on one's body and allows the functioning of it. Sexual health is important for everyone through all ranges, but definitely factors still within the older generations, as it just values different beliefs and values within individuals and relationships to grow with relationships and intimacy.
Hi, my name is Chamaka Chikusum Precious, and I'm going to be talking about how does sexual health challenge aging. Sexual health can affect healthy aging older adults in several ways. Firstly, physical changes. As people age, their bodies go through changes like menopause in women and erectile dysfunction in men. Chronic illness like diabetes or heart disease can also make sexual activity harder. Secondly, mental and emotional health. Aging can affect self-esteem and confidence, especially with changes in appearance. Depression, anxiety, or losing a partner can also make it harder to maintain intimacy. Thirdly, social stigma. Society often assumes older adults are not sexual, which makes it harder for them to talk about sexual health or get help. Also, we have sexually transmitted infections, STIs. Since pregnancy is not a concern for older adults, they may be less likely to use protection, increasing their risks of STIs. Lastly, limited access to resources. Many older adults do not have sufficient information or access to sexual health services, and the cost of medications or treatments can be a barrier. Addressing these issues is crucial to helping older adults maintain their sexual health, confidence, and overall well-being.
Hi, my name is Kim Kamiyama, and I'm going to go over the information we reflected on as a group and the ways to contribute to optimizing your sexual health as an older adult. So Driscoll and Hughes argued in their narrative case study approach that those who identify as sexual or desire improvement for their sexual health, despite the deterioration to health, endocrine changes, or pharmacological changes, those people were more likely to be able to enhance therapeutic outcomes that related to their overall well-being and relationship satisfaction. And communication is a big factor, so such as education, literacy, individual or group counseling. It's been proven to improve one's well being and it reduces stigmas that are related to sexual health in older adults and the desires, enhances knowledge and provides you with options and resources for optimizing your sexual health as an older adult. With this knowledge, it will help us as nurses to adhere to a few CCPNR competency standards of practice. For example, number 41, it allows us to formulate clinical decisions consistent with client needs and priorities. So, by being aware of the factors related to compromised sexual health, as well as interventional treatment options and resources. And then number 44 also implements nursing interventions based on assessment findings, client preferences, and desired outcomes. So, based on the information provided by the patient, in our knowledge as a nurse, We'll be able to counsel and provide our patients with appropriate interventions and supports so that they're able to be successful with their outcomes. And I'm going to pass this
Promoting
on so we
healthy
can hear
sexual
about
health.
ways to promote
Sexual health can be a
sexual health.
challenge topic amongst aging adults due to its health factors such as menopause, erectile dysfunction, mental health problems, and sexual preferences. In order to promote sexual health, we must create a safe space by normalizing the conversation and informing adults that aging can affect libido, especially in aging adults. However, there are ways to promote sex drives, such as medical advices, self care practice, good diet, pharmacological drugs can be done or taken to promote sexual health. And it is also important to promote mental health, as depression and any other kind of mental health problems can affect the desire and enjoyment. And with these, you can provide resources such as a website about mental health, sexual health, or even a helpline, or even doctors or psychologists. And lastly, understand that others may have sexual preferences and to be non judgmental and have an open mind and open ended questions when dealing with those patients.
So, to finish this off, I just would like to point out a few important things to just keep in mind that older adults really strive through social influences. So, keeping them active in their day to day activities, making sure that they are going out on their regular outings and involved in things like bingo and other activities like that so that they can really have engaging relationships and keep up on that. Also, it's important to create a safe space for older adults and to really allow them to comfortably have the conversation regarding their sexual health, letting them know that, excuse me, it really is a healthy part of aging to still be active regarding their sexual health. Also, I think it's important to know that because pregnancy is not really a concern for older adults, they may be less likely to use protection, and that would increase their risk for sexually transmitted diseases because of that. Also, letting them know and educating them that counseling and just talking to somebody about their sexual health and their sexual habits, that it will benefit the well-being of the individual and the older adult.